Good evening and thank you. And Anna, if I knew you were going to speak first, I would have asked to go before you. So, wonderful remarks, Anna. So thank you. And I want to thank my other fellow honorees tonight as well, Liz Sargent, John Jang, for sharing this night's honors with me. I'm very honored to be here, and I'm profoundly grateful to CIDA for the important work that you guys do every single day. You saw examples of it today. The commitment to inclusion and advocacy and partnership is so meaningful, and it means that we're changing lives. And thank you for honoring me, for honoring Northwell. And we accept this recognition on behalf of the many leaders and colleagues and mentors who've worked together at Northwell to make inclusion real, not just a promise, but a practice for us. And it's not a program, it's a principle that we embrace. It's a belief that every person deserves dignity, opportunity, and frankly, a seat at the table. And that responsibility means that we have to listen to individuals and their families, we have to learn from their experiences, and we have to focus on removing barriers. It means seeing a strength, attention to detail, creativity, resilience, and recognizes that neurodivergent individuals, individuals with disabilities, bring essential skills and perspectives that make our organizations better, and frankly, our communities stronger. At Northwell, we really embrace inclusion. It's one of our core values. We just don't help people. We want to change systems. We want to change the workplace. We want to change culture. And more importantly, we want to give hope. We're committed to making a difference and improving the lives of people with disabilities, both as patients and as colleagues. We've learned that sustainable impact comes from partnerships because no one could do this alone. We've centralized and strengthened our efforts to serve individuals, building a more coordinated and accessible continuum of care across our inpatient and outpatient settings. I'd say that's one of our big focuses now, is to provide specialized access throughout our geography to work with families and individuals, because we really need to pursue, this is a fundamental aspect of health equity, frankly. And we have to do so by making our healthcare environment where we deliver care to be more accommodating. And in our workplace, we're investing in inclusive pathways. Our neurodiversity virtual mentorship programs has been created by our Readiness Inclusion team in a partnership with Bridges to Adelphi. This is a program where we're connecting neurodiverse college students with Northwell's leadership, and then we essentially create mentorships and internships for individuals to get firsthand insight into health careers and build their skills and confidence through a series of projects to take on roles with increasing responsibility. And that impact has been mutual. The mentees and the mentors kind of learn from each other. We grow together. We prove that inclusive teams are stronger teams. And we also have another initiative called Autism in the Workplace. That's been supported by the Simons Foundation. We've offered apprenticeship that lead to real employment opportunities. We've trained our managers. We've adapted our onboarding, we've provided mentorships, and we've seen apprenticeships thrive in areas like IT, our client services, and our lab information systems. And frankly, we need individuals. We're New York State's largest employer. We employ over 104,000 people. And we recognize the strength of doing so by being inclusive. And we also recognize the individuals in our organization who may have family members who have volunteered to be mentors, and we've given out awards to those individuals. We recognize them for their advocacy, their community outreach, and employment support. Because what we've learned is these colleagues prove that when we elevate inclusion, we elevate everyone. And all of this is possible because we share mission with partners like CIDA to build trust and to open doors and create these equitable opportunities. We want to see caregivers see their loved ones supported, mentored, and included, where families become part of a healthier and a more hopeful community. And if I may, I'd like to speak as a parent. My wife and I are the parents of a neurodivergent individual. Like many of you, we carried deep fears. We worried whether our child would ever find meaningful work, whether they could live independently, whether the world would understand their strengths and honor their needs. What changed our lives was an opportunity and compassionate mentorship. Northwell gave our daughter a chance to acquire skills, and she had very thoughtful managers who supported her, who coached her, who allowed her to grow. She didn't just secure employment, she thrived. And she moved out of our home, she built a life, and just 30 days ago, we celebrated her marriage. So, thank you. And so, to every parent in this room who is anxious, who wonders what the future will hold, I see you. I felt those fears, and I want you to know hope is real. And thank you to CIDA for being a beacon, educating, advocating, and partnering to make inclusion possible. Thank you for honoring Northwell, for inspiring us to keep going. I promise you at Northwell, we will continue to invest in these partnerships. We will expand access to care. We'll create pathways to employment that recognizes talent and nurtures growth. But that's a shared responsibility where we have to stay united. We all have to keep listening. We have to learn, we have to lift, and we have to ensure that every person confronting these challenges and every family feels seen, feels supported, and feels hopeful. And that's why it's so important for all of you in this room to support CIDA in its efforts and to do so generously. Dr. Young Sebe and CIDA, thank you for the work you do every day and for the futures you make possible. And I am honored to have been here with you.